And in honor of Breast Cancer Awareness Month, we are talking about an important health topic that affects nearly half of all women. While having dense breasts is normal, it does increase the risk for breast cancer and can make screening more challenging. Dr. Debra Patt is an oncologist at Texas Oncology. Dr. Patt, thank you so much for joining us.
Thanks for having me, Jenny.
Can you please explain what dense breasts are first?
So think about it like when you look out your window and you look at some structure down the street. It's as if you were looking out on a very foggy day, so you couldn't see the house next door. So when you think about that analogy, you can envision that it's harder for mammography to see through dense breasts because it's as if they have a fog over them.
Right. So how common is it?
It's really common, actually. And breast density happens, either people have low density breasts or, moderate, mildly or extremely dense. So it's quite variable, but it's a pretty common finding because it naturally occurs, especially as we're younger. And as we get older and when we have less estrogen in our body, our breasts over time do usually become less dense.
Here's what's scary to me, Dr. Patt. Dense breasts are associated with a higher risk, cancer risk. Can you explain why and how significant is that risk?
So we know that it is an independent risk factor for breast cancer. Extremely dense breasts, which is sort of the highest density level, doubles your risk of breast cancer. So you think of someone having an average risk of about 1 in 8 for an average woman, because breast cancer is common. You think about that as it doubles your risk. So that's about 1 in 4 women with extremely dense breasts will have breast cancer. And it's important to understand, Jenny, because not only do they have an increased risk, but because mammography is less sensitive because of the fog, we frequently recommend that people undergo supplemental screening with an MRI, so that way we can get a better view through the fog. And so it's important to talk to your doctor not only about your own risk based on your family history, but also if you have dense breasts, how to manage it. Because if we appreciate that you have a higher risk, there are some risk-reducing strategies that we can use, and we would certainly recommend a different screening schedule.
Well, let's talk about other screenings besides mammography. Yeah, for dense breasts. I've read 3D mammographies, MRIs. Talk about all of that for us.
So because mammography is a wonderful screening tool, even for dense breasts, but because dense breasts have a fog, sometimes we have to do supplemental screening. And there are a couple of options. So using contrast-enhanced mammography, it's kind of like a CT scan because they use a radionucleotide contrast and then also do mammography.
Or what is that?
So it's radio-labeled contrast. So it's an injection that you get that allows you to see better within the breast because of the use of contrast, or magnetic resonance imaging or MRI of the breast that also uses contrast. Because of the enhancement with contrast, you can have a higher sensitivity of the screen, and that can give you some additional information. So sometimes women either who have a high risk of breast cancer because of their family history or genetic risk, or who have dense breasts might augment their screening by also doing additional tests. And it's best that women just talk to their doctor about it. Don't suffer in silence. I'll tell you, every day, including today, I just left my clinic to come here, and we had a woman that someone told her to get screened. She got screened. She detected a breast cancer that's smaller than a dime, and so she's unlikely to need things like chemotherapy. She'll have a quick surgery, a little bit of radiation, and take a pill, and overwhelmingly likely that her breast cancer is cured.
Prevention saves lives.
That is
Screening
correct.
saves lives.
That is correct.
Thank you for coming on KVUE News Midday and sharing life-saving details. If y'all want to contact Dr. Patt, she's at Texas Oncology. Thank you so much.